Hi, Dr. Yass here. I'd like to talk to you about the understanding of what pain is and why you must recognize that if you get a treatment or a procedure and you have the same pain, if not greater levels of intensity of pain, that has to indicate that the tissue that was just treated clearly was not the tissue eliciting your symptoms. Let's go to the original premise of why we have pain or altered sensations. That is because these should be recognized as distress signals. They're the body's attempt to create conscious awareness of distress of tissue. So the specific symptoms we're experiencing are recognizable to specific causes, whether it's a bone, a muscle, or a nerve. Typically, the three primary tissues associated with pain or altered sensation at the neck, the back, or the extremities. When we're having pain or an altered sensation, it's the body's attempt to create conscious awareness of distress of that tissue. The idea being that by becoming aware that there's distress of a tissue and identifying the proper tissue, an intervention can be performed to resolve the distress of the tissue. We never treat the symptoms. We are supposed to treat the distressed tissue. We resolve the distress of the tissue. There's no longer a need to create this conscious awareness anymore, and the symptoms simply resolve or simply go away. They cease. So, you have back pain. You are told the cause is a herniated disc, stenosis, or arthritis, or a meniscal tear, a pinched nerve, or spondylolisthesis, or a compression fracture. A treatment is provided, surgery, or any other form of treatment to this structural variation you are being told is the cause of your symptom. And after it, you have the same symptom, if not with greater intensity. You must immediately recognize that this indicates that the tissue that just was treated was not the tissue eliciting your symptoms. At that point, you cannot accept anything further that medical practitioner attempts to convey to you as to some further along type of treatment they'd like to do. They get one shot. That's the way this is supposed to work. They evaluate you. They tell you that the symptom you're experiencing is coming from a particular tissue. They treat the tissue. You either have an immediate, at least great reduction in the level of symptom or complete resolution of the symptom. But if you have the same level of symptom or even worse, a greater level of symptom, you must immediately acknowledge that the tissue that was treated was the wrong tissue. Therefore, no trust can be left in that individual. And therefore, all treatments should end. All attempts to move further in doing greater diagnostics should end. Accept the premise that your symptoms are indications of tissues in distress. The purpose of diagnostics is to identify the appropriate tissue. The person gets a chance to do that by whatever means they choose. If in fact they choose the tissue, treat the tissue, and the symptoms remain, they've treated the wrong tissue. All confidence must be discarded. The reason I'm pointing this out to you is because when you use the MRI, in more than 90% of cases, you will be misdiagnosed. As a result of that, you will be treating the wrong tissue. As a result of that, you're going to have the same, if not greater, pain after the treatment. Everyone's going through the same thing. Everyone's experiencing this. The problem is that you just go on believing that, well, they still could find an alternative way of identifying the tissue, or maybe another type of treatment can be performed. Let's just make this clean and clear. They get a chance to establish what tissue is eliciting your symptoms. They have a chance to treat the tissue they think is eliciting the symptom. When the symptom is still existing after the treatment, it has proven that they have failed in properly identifying the tissue. And as far as I'm concerned, no further treatment should be performed. No further diagnostics should be performed. You should step away and call it quits. It's only going to get worse if you continue. If you want to understand how to properly diagnose, you look at the Yas Method. This is a mechanism that actually looks at your symptoms, the interpretation of the body's presentation of symptoms, along with some specific tests, and then is able to identify at an astonishing level of accuracy what tissue is eliciting the symptoms. In more than 95 to 98% of cases, it's muscular. By understanding that the reason you're having symptoms is because the tissue in distress is muscle, and muscle is only in distress because it doesn't have enough strength or there's some lack of balance preventing the muscles from being able to create appropriate amounts of force to deal with the force requirements of the activities you're trying to perform. If this, in fact, is the cause, and that is the tissue, well, then there's only one mechanism that can allow that, one treatment form, and that is targeted progressive resistance exercise. This is a cornerstone of the Yas Method and its mechanism for treating pain when it is found to be muscular. So, if you've already gone through the process with other practitioners, you've gone through the process of having diagnostics, you've gone through the process of having treatment, and you're still having the same symptoms, simply accept the fact that the wrong tissue has been treated. That is by nature, based on the definition that the pain or altered sensation was an indication of a distress tissue. The tissue that they chose to treat did not alter the symptom. Therefore, you have to assume the wrong tissue was treated. My suggestion, find the Yas Method, see its value in utilizing an interpretation of your symptoms versus this ridiculous, invalid nature of using diagnostic tests. And if it's found to be muscular, which it is in 95 to 98% of cases, the Yas Method has the ability to understand which muscles are required to be strengthened, understands how to perform the proper exercises, and understands the use of progressive resistance, which is the only mechanism to allow a muscle to get stronger, to allow it to then be able to create the appropriate force within activities and prevent it from straining while you're performing those activities. If you want to get more information about the Yas Method, my suggestion is go to the website, www.mitchellyas.com, MITCHELLYASS.com, or just contact me directly by email. My email is drmitch@mitchellyas.com. That's drmitch@mitchellyas.com. Or call me on my cell phone. My number is 516-449-1359. I do this because I think it is critical that people have the opportunity to get the right diagnosis so the right tissue can be treated, so the right treatment can be performed, so you can end your symptoms and get back the life you deserve. Nobody should suffer from chronic pain. A cornerstone principle of the Yas Method is that most chronic pain is nothing more than misdiagnosed acute pain. Look around. When you look at the failed system and how everybody continues to suffer after all the treatments and all the procedures, it will make sense. You need to get the Yas Method. You need to have your symptoms resolved. You need to get back the quality of life you deserve. For now, this is Dr. Mitchell Yass wishing you a pain-free and fully functional life. Bye-bye.